What's up, you guys? This is your boy Miguel giving you your daily dose of radiation. In today's video, we will be covering common questions asked by patients over X-ray in general or safety. So, some of the more common ones we'll get. We'll just start with regular patients, just a standard patient. The amount of questions they'll ask sometimes is, will my phone be in the way? Is my necklace good? I'm pregnant. I think I'm pregnant. Or will my button show? Can I see the picture? You said left, I thought you said right. Like they'll ask some of the more peculiar questions. Or the pacemaker. And I learned why they asked about the pacemaker, because they kind of engraved into these poor patients that if you're gonna get radiation, make sure you tell the tech that you have a thing, but they don't tell them that's only for MRI. So they just kind of like that, because I've asked some of them, because it's happened so many times, and they just tell them in radiation in general. So other common stuff that will be asked is on their baby. They're like, okay, I got an X-ray done at this other hospital. Can you see it? And then we're like, ma'am, for us to be able to see it, you know how many paperwork, how much stuff has to be done to acquire it? Most of the time, it's faster and easier if we just shoot it here for faster diagnosis. It's kind of the general term I've been told to tell the patients. I do understand if it's certain exams with higher dose of radiation that shouldn't be performed as often, or if the patient is prone to getting a lot of exposures, why you wouldn't want to re-expose, but that's a common question. Or another one is like, I just got it shot down at the urgent care. Can we see it? And then I'm like, well, why did you come back to us? And they're like, well, I was still short of breath. And he's like, well, if it's been an hour, it's been 2 hours, maybe your body has gotten worse, Or another common question is like, why am I getting this done? And I would just sometimes, it all depends who the doctor is, but sometimes it makes sense why they ask that, because the doctor won't tell them that they're getting X-rays, and then you just show up, and then you're like, and then sometimes I'll ask, I'm like, did the doctor tell you that you were getting X-rays? Like, no, they didn't. And I was like, makes sense why you're always questioning us, Or sometimes they'll send X-rays for stuff that really doesn't need X-rays, but they'll do it anyway, because when they order certain stuff, it kind of gets automatically generated, and they don't even know sometimes that they order chest X-rays. And I didn't believe my supervisor when he told me this, but it happened like twice to us, and I was like, damn, sad. But that's something that'll happen from time to time. Let's see what else. So if you're like in the trauma, a lot of the times the patients will be freaking out and asking a lot of questions, and most of them is like, where's my parents, where's my family members, can you do this, can you do that? And most of the time we're just like, oh, we'll ask the nurse. It's kind of our common repertoire of questions and answers type dealio, because most of the time we really don't know. We just literally do X-rays and then just bounce. That's kind of the name of our game. they'll ask you for medicine or like just basic common stuff. You'll learn as a student what happens in the game of X-rays. Or there's certain people that will ask you, which I mean everyone should be entitled to, you know, radiation safety as the max, but they'll be so concerned about some stuff about their I understand, but like at a certain age, like you'll see some of the older techs who've been in the game pretty long, the like it'll be like an 80-year-old woman, and she'll be like, oh, can I get, you know, some lead? I'm trying to, you know, protect my ovaries and all this stuff. And they'll always be like, the techs, the other ones, I'm like, if you want it, okay, I'll always offer it. I'll always do my best to, you know, provide it. But you always hear those certain techs, especially the older ones who've been in the game like 20, 30 years. They'll be like, ma'am, like, they won't tell them, but like they'll leave. And then they'll tell them, they're like, ma'am, why? Like, why? What is the point of you having it? And I was like, you know, it's to keep them safe. He's like, yeah, I understand that, but he's like, are you gonna have kids? What's this one radiation? And I'm like, so it's kind of iffy in the field sometimes. But most of the time, it's just basic questions, concerns, or the wait time, how long it's gonna be. And I mean, you can use your better judgment depending how the ER is to be like, okay, it's probably usually 15 to 30 minutes. Is if it's empty, 15 30 minutes. Hell, sometimes we'll shoot it and we'll send it and they can see it before we even adjust it and post-process it. Sometimes it's that fast and they'll be in there talking literally within seconds after we finish. But I mean, you don't tell that to the patient. You usually say 30 minutes, you know. Keep your window time, because it's always better. I learned from my supervisor. It's always better to give 30 minutes and then the doc come in 10 to 15 than to you say 15 and have the patient waiting 30 minutes and then they're gonna be like, yo, what's going on? So it's kind of like it's always better, you know. And then when it's full, and I'll be like, yo, it's gonna probably like 30 minutes to an hour, because like they have a lot of X-rays to do. You kind of, you know, tell them it's gonna be a little bit, unless it's trauma. They're like, okay, well, we'll get the doctor right away to look at it. Usually the time, if it's like that, real trauma, the doctor will be there and look at it and be like, yo, this is wrong with you, or this is what we gotta do. But yeah, it's been your boy Miguel. Hope you enjoy your daily dose of radiation. See you on the next one.